If you are over 50 and still engaging in masturbation, there is an important aspect of your prostate health that deserves your attention. I'm Dr. Samra Turajilic, a urologist with over a decade of experience helping men preserve both sexual function and prostate health as they age. Today, I want to address a topic that is often avoided in clinical conversations, yet deeply relevant: masturbation after the age of 50. What I'm about to share is grounded in long-term scientific research and may reshape how you understand this natural behavior. A large prospective study conducted by Harvard Medical School followed nearly 32,000 men over 18 years. The findings were striking. Men who ejaculated 21 or more times per month demonstrated approximately a 20% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times monthly. This is not a trivial difference. It represents a meaningful reduction in risk achieved through a natural, accessible physiological process. Importantly, these findings have been supported by additional research, including studies published in journals such as European Urology and BJU International, reinforcing the consistency of this association. To understand why this occurs, we need to consider prostate physiology. The prostate is an active gland that produces seminal fluid. When ejaculation occurs regularly, this fluid is expelled, preventing stagnation. Without regular clearance, prostatic secretions may accumulate, potentially contributing to inflammation, oxidative stress, and cellular changes over time. From a biological perspective, regular ejaculation appears to support what we call prostatic turnover, helping maintain a healthier microenvironment within the gland. Think of it as maintaining flow within a system. Consistent movement reduces buildup and supports functional integrity. As men age, the prostate naturally enlarges, a condition known as benign prostatic hyperplasia. By the age of 60, approximately half of men experience some degree of enlargement, and by 85, that number approaches 90%. Alongside this, risks of prostate cancer increase, urinary patterns may change, and sexual function evolves. Within this context, regular ejaculation, whether through partnered intimacy or masturbation, can serve as a protective and supportive mechanism that many men are never informed about. Let's talk about frequency. Research consistently points toward a threshold of around 21 ejaculations per month, which averages to roughly 5 times per week, as being associated with the strongest protective benefit. This includes all forms of ejaculation: sexual intercourse, masturbation, and even nocturnal emissions. What matters is the cumulative frequency over time. However, it is important to emphasize that more is not necessarily better. Beyond this range, the additional protective benefit appears to plateau. Balance remains essential. Now, technique becomes increasingly important with age. As the skin becomes thinner and less elastic, inadequate lubrication can lead to microtrauma, irritation, and even long-term sensitivity changes. The use of appropriate lubrication, preferably water-based or silicone-based, is not optional. It is protective. Similarly, excessive grip pressure can create a cycle of reduced sensitivity and compensatory force, which may ultimately impair function. A more mindful, moderate approach supports both comfort and long-term tissue health. Another modern factor worth addressing is excessive reliance on highly stimulating visual content. Over time, this can alter the brain's reward circuitry, particularly dopamine pathways, potentially leading to decreased responsiveness to natural stimuli. From a neurological standpoint, this is not about morality, it is about neuroadaptation. Maintaining a balanced approach helps preserve natural arousal patterns and supports healthier, intimate relationships. It is equally important to recognize warning signs. Pain during ejaculation, burning with urination, blood in semen, or difficulty achieving ejaculation are not normal findings. These symptoms may indicate conditions such as prostatitis, infection, or other urological concerns and should prompt timely medical evaluation. Early intervention often prevents more complex complications. Beyond physical health, there are measurable psychological benefits. Sexual activity, including masturbation, triggers the release of several neurochemicals. Dopamine contributes to motivation and pleasure, oxytocin promotes relaxation, serotonin stabilizes mood, and endorphins provide natural analgesia. Additionally, prolactin released after orgasm has been associated with neural recovery and stress modulation. For many men navigating midlife transitions, whether related to career, relationships, or health, this natural neurochemical cascade can offer meaningful support for mental well-being and sleep quality. Another critical aspect is the preservation of erectile function. Erections rely on vascular health and tissue responsiveness. Regular sexual stimulation promotes blood flow, maintains endothelial function, and helps preserve the elasticity of penile tissue. Without regular activation, there can be a gradual decline in function, a phenomenon often described clinically as use it or lose it. Maintaining consistent activity, even in the absence of a partner, helps sustain these physiological pathways. I also want to address something that is often overlooked: psychological burden. Many men carry long-standing feelings of guilt or shame related to masturbation, often rooted in cultural or religious messaging. From a strictly medical and scientific standpoint, there is no evidence that moderate, healthy masturbation causes harm. In fact, as we've discussed, it offers multiple benefits. If there is internal conflict, it may be helpful to explore that with a counselor or trusted advisor, but it is important to separate cultural narratives from medical reality. That said, there are situations where professional guidance is necessary. If sexual behavior becomes compulsive, interferes with daily responsibilities, or creates distress, it may fall under what we classify as compulsive sexual behavior disorder. Persistent physical symptoms, pain, bleeding, or dysfunction also require evaluation. And if masturbation begins to replace partnered intimacy entirely, it may indicate underlying relationship dynamics that deserve attention and communication. When we bring all of this together, a clear evidence-based framework emerges. Aim for regular ejaculation, approximately 20 to 21 times per month, while maintaining a balanced and mindful approach. Use proper lubrication, avoid excessive force, allow adequate time for full physiological response, and stay attentive to your body's signals. If you choose to use visual aids, do so in moderation. And most importantly, approach this aspect of your health without shame, but with understanding. Masturbation after 50 is not a sign of decline or something to conceal. It is a normal, biologically relevant activity that supports prostate health, vascular function, and mental well-being. The scientific evidence is clear. Regular ejaculation is associated with a reduced risk of prostate cancer, improved erectile function, better stress regulation, and overall healthier aging of the male reproductive system. Your age does not diminish the importance of your sexual health. It amplifies it. You have a simple, natural tool that can contribute meaningfully to your long-term well-being. The key is to approach it with knowledge, balance, and respect for your body.